The earth is our home. It is our only home. The air, the water, the soil, the earth's temperature orchestrate the conditions by which all of creation can live and thrive. The quality of the air, water, soil, and temperature are critical to all species, including humans. Our home is now being threatened by conditions that humans have created. Our air is being contaminated by our transportation sources, cars, trucks, planes, by our energy production, including coal-fired power plants, the burning of wood, methods of extracting gas and oil, and by manufacturing plants. Our water is polluted by point sources including industrial pollution, as well as general pollutants such as agricultural runoff with pesticides and fertilizers. Through current agricultural land use practices that are causing extensive soil erosion, we are losing the Earth's layer of soil, which is absolutely essential to produce food. The pace of global population growth is challenging the Earth's capacity at every level. In many communities, efforts to merely survive take every moment of the day. And the manner in which we are wasteful and trash the planet is dreadful and totally not sustainable. Approximately 40% of food in the U.S. alone goes to waste. Roughly 1/3 of the food produced in the world for human consumption, which is approximately 1.3 billion tons a year, gets lost or wasted. The production of this wasted food takes energy, requires transportation, which contribute to climate change and unhealthy air, water, and soil. This is an unconscionable situation. We are wasting an enormous amount of water with our current practices, especially in the U.S., where cultivated lawns are a major feature of suburban life. Almost a quarter of our total household water use is wasted on ineffective outdoor watering. In our race to have the latest phone and other electronic devices, we are leaving a huge trail of electronic waste. But this also translates into increased use of natural resources, energy use for manufacturing and transportation, and land use issues for its final disposition. Unwittingly, our hunger for the latest gadget is contributing to the trashing of the planet and to climate change. We are also producing an enormous amount of household waste, more than 3/4 of which we could be recycling or turning into compost. Pope Francis and others are calling upon us to wake up to the harm that we are causing with our excessive consumerism. The health of the Earth is critically linked to the health of all life. In 2015, Pope Francis brought to the world's attention what scientists had recognized for decades, that we must more consciously care for Mother Earth and for the most vulnerable of its inhabitants, both human and non-human. Other religious leaders from around the world echoed Francis's impassioned plea that we take steps to reverse the trajectory of human-caused harm to Mother Earth. Francis' explicit focus was on climate change, the existence of which is scientifically undeniable. Within this focus is an urgent call for us to care for populations that are most vulnerable to the effects of climate change: the historically marginalized, the poor, the very young, the frail elderly, people from coastal regions and island cultures whose lands are being washed away by rising sea levels, those in the paths of extreme weather conditions, and of course, those who are already made vulnerable because of underlying health problems. The messages within the encyclical are both simple and complex, as expressed by Pope Francis.
Never have we so hurt and mistreated our common home as we have in the last 200 years. The exploitation of the planet has already exceeded acceptable limits, and we still have not solved the problem of poverty. We are not faced with two separate crises, one environmental and the other social, but rather one complex crisis that is both social and environmental. The idea of infinite or unlimited growth, which proves so attractive to economists, financiers, and experts in technology, is based on the lie that there is an infinite supply of the Earth's goods, and this leads to the planet being squeezed dry at every limit. Yet all is not lost. Human beings, while capable of the worst, are also capable of rising above themselves, choosing again what is good, and making a new start. The climate is a common good, belonging to all and meant for all. We need to strengthen the conviction that we are one single human family. We must regain the conviction that we need one another, that we have a shared responsibility for others and the world, and that being good and decent are worth it.
Nurses have a huge role to play in earth care and human care, and we recognize that these two things are inextricably bound. We are already in every community, serving every population. We are in people's homes, workplaces, schools, clinics, and of course hospitals. Social justice is an intrinsic value to all nurses. And nurses are also active members of our communities through our faith-based organizations, civic organizations, parent-teachers associations, and neighborhood groups. We can be found in every community. 1 in every 100 Americans is a registered nurse, and worldwide there are 20 million nurses. And environmental health is now in the domain of the professional nurse, as articulated in the American Nurses Association Scope and Standards of Professional Nursing Practice. We have immense potential to educate the next generation of nurses, the public, as well as policymakers, about the human health impacts of climate change and the relationship between human health and air, water, and soil quality. But first, we will have to educate ourselves, including integrating climate change content into nursing school curriculum and continuing education programs. We can lead by example by making positive changes in our own lives as well, in our homes, workplaces, and communities. We can make home purchasing decisions that both decrease our impact on climate change, decrease our family's exposure to toxic chemicals. We can help lead our communities in efforts that support walkable neighborhoods and good public transportation both of which have tremendous co-benefits to human health and ecological health. Nurses can be leaders within our workplaces, helping to identify opportunities for energy savings, safer purchasing options, incentivizing carpooling, purchasing and serving local and sustainably grown foods, and disposing of waste in the most ecologically healthy manner. We can take steps to analyze and diminish our home, work, and community carbon footprints. Nurses have helped to create green teams in hospitals and schools around the country. Working together, they have made tremendous exemplary changes. Nurses have been changing waste practices to close the loop on many recyclable waste items, including blue wrap in the operating room, batteries, and other products. They have been expanding opportunities for multiple-use devices, where before single-use devices were standard practice, guiding hospital purchasing decisions towards environmentally safer and healthier products, reducing the use of unhealthy cleaning and disinfecting agents, helping to bring local, sustainable, and healthy food to hospital cafeterias, and bringing farmers' markets to urban food deserts. Nurses find opportunities to save energy and to incorporate them into hospitals' best practices. Nurses do all this as they also provide care to our families and friends at their most vulnerable. They care for all communities and all individuals. Social justice is a deeply felt value that nurses incorporate into their daily practice as they serve and advocate for everyone's health. They are also on the front lines in caring for those who are and will be affected by the ravages of climate change. Often the tone of climate change news and information is quite dramatic, frightening actually.
To the nation right now and for a while, portions of some 25 states under severe weather watches or warnings. So whatever happened to this?
Melting away, there is new and dramatic evidence.
The world is heating up fast and we have ourselves to blame.
The bombardment of such news coverage is not always helpful. It makes us feel like there's nothing we can do. How can we do anything about the glaciers that are breaking up in Greenland? The task seems remote and immense and out of the realm of possibilities. While extreme events like fires and storms are in fact likely to continue to worsen, most nurses will experience climate change as a more subtle shift. We will see more asthma, more Lyme's disease, both acute and chronic, as well as other vector-borne diseases. And we will see steady increases in a number of cardiovascular and other diseases. We will see more heat-related emergencies, especially among those who work outdoors and the elderly. If we are not prepared, we will see the death of more people who are unable to cope with or escape from extreme heat events. The frail elderly, those with developmental and physical disabilities, and those with mental health problems may not be able to or understand to get to an established cooling center. As nurses, we can help our communities prepare for this. We can inventory our communities to identify the most vulnerable, especially those who could not get to a place in the community designated as a cooling center. Let's be creative. The vast majority of scientists of the world are aligned on the predictive nature of the data. Climate change is real, and the evidence is mounting. Nursing is an evidence-based profession. We must incorporate the evidence of climate change into our nursing practices in order to address current climate change-related health effects that we are seeing right now, as well as prepare for conditions that may worsen. Our reliance on fossil fuels, coal, gas, and oil, is making us sick. The evidence is clear, and yet we are not adequately acting on it. Nursing is a profession rooted in the art of caring. This comes from our hearts and from our deepest values. In order for us to care for our patients and communities, we must also now care for the earth. For it is Mother Earth that is in deep trouble, and with her all of her inhabitants. Every major religion on earth now recognizes the critical nature of climate change. There has been a global chorus of religious leaders calling upon us all, citizens and heads of state alike, to help bring forth a new era on earth. One in which rampant consumerism is not the economic driver, but instead the driver is our commitment to care for each other and for the earth, where cleaner energy sources replace fossil fuels, and where social justice and equity are reigning values. In addition to Pope Francis's encyclical, all of the major religions have joined in a call for action. From the Jewish climate change campaign, we hear that climate change is both a global crisis and an immense opportunity. It challenges us to live better and walk more responsibly on the earth. In the Islamic Declaration of Global Climate Change, it states that
the world is sweet and verdant, and verily Allah has made you stewards in it, and He sees how you acquit yourselves. Realize that to chase after unlimited economic growth in a planet that is finite and already overloaded is not viable. Growth must be pursued wisely and in moderation, placing a priority on increasing the resilience of all, and especially the most vulnerable, to the climate change impacts already underway and expected to continue for many years to come. Set in motion a fresh model of well-being based on an alternative to the current financial model which depletes resources, degrades the environment, and deepens inequality. Prioritize adaptation efforts with appropriate support to vulnerable countries with the least capacity to adapt, and to vulnerable groups including indigenous peoples, women, and children.
in the Hindus' Declaration on Climate Change, it notes that
unless we change how we use energy, how we use the land, how we grow our crops, how we treat other animals, and how we use natural resources, we will only further this pain, suffering, and violence. On a personal basis, we can reduce this suffering by beginning to transform our habits, simplifying our lives and material desires, and not taking more than our reasonable share of resources. We have a dharmic duty for each of us to do our part in ensuring that we have a functioning, abundant, and bountiful planet.
And from our Buddhist brothers and sisters, we hear,
the earth is not just our environment. The earth is our mother. We are all children of the earth, and we must help one another as brothers and sisters in one big planetary family. We must take action, not out of a sense of duty, but out of our love for our planet and for each other. The Buddha has shown us that we can all live simply and still be very happy.
What all the religious leaders and the world scientists agree upon is that we must make major changes and make them now. So how can nurses exert our leadership in this critical time of human and ecological need? In addition to preparing ourselves to address the health and safety needs of our patients and communities, there are many ways. First of all, we need to be using our trusted voices to validate that climate change is real and that its effects are already being experienced in terms of human health. We can do this in our homes with our families, in a great many community organizations that we belong to, like our faith-based organizations, civic organizations, when we organize health fairs, in parent-teacher associations, and among our wide web of friends and associates. We can encourage educational programs at our libraries, town halls, granges, and other gathering places. In our homes, we can make changes in our personal energy choices that will help to save energy, such as using LED bulbs and using Energy Star appliances. And we can shift to renewable sources for our electricity. We can increase our use of public transportation and carpools, buy locally produced fruits and vegetables when that's possible, and be more conscious consumers generally. Nurses work in many different settings, and in each of them, we have a role to play in helping to decrease our reliance on fossil fuels, including the use of petrochemically produced products like plastics. By creating green teams in our hospitals and schools, or working with existing ones, we can make systematic changes. Through our professional organizations, we can encourage educational efforts on climate change and its effects on human health.
Hello, my name is Beth Schenk. I'm a nurse. I live in Missoula, Montana. I'm employed by Providence Health and Services and also Washington State University College of Nursing. I've been interested in climate change issues for a number of years and have worked hard to do what I can to both educate, mitigate, and adapt to climate change. This is a natural role for nurses in practice in any area where nurses practice. It fits with our scope of practice, our standard of practice that says the registered nurse practices in an environmentally safe and healthy manner. How do we do that? In hospitals, it's easy because hospitals take so much energy, and nurses can be very involved with efforts for energy conservation and for moving toward renewable energy. Also in the community, nurses can be involved. I'm involved in an organization called Climate Smart Missoula, which helps to educate and bring together people who want to create a better future through mitigation of greenhouse gases and adaptation to the already apparent changes in our heat and drought in the Rocky Mountain West. We focus particularly on health issues for those who are more vulnerable in our communities. Another way that nurses can be involved is in education. We educate our patients all the time, our family members, our community members, and students with whom we interact. It's really important that people hear from nurses, the most trusted voice in the nation, and we talk about why this matters to people on the ground every day. So all nurses can be involved in working toward improving the world by addressing climate change. Thank you very much.
It's 3:23 in the morning, and I'm awake. Because my great-great-grandchildren won't let me sleep. My great-great-grandchildren ask me in dreams, what did you do while the planet was plundered? What did you do when the earth was unraveling? Surely you did something when the seasons started failing, as the mammals, reptiles, birds were all dying. Did you fill the streets with protest when democracy was stolen? What did you do once you knew?
In this learning module, nurses have put together materials and resources that can help you better understand and respond to climate change. After this video, you will be presented with a menu of options that include a short video by the Intergovernmental Panel on Climate Change, outlining our current understanding of the science of climate change. A longer video by Dr. Wendy Ring, family medicine physician, who does a very nice job reviewing the health effects that may be caused by or exacerbated by climate change. There's also a slide presentation on ways in which you can green your hospital. And there will be a great pile of resources, including recommended websites with a brief description about each one. In addition, we invite you to become active in the Alliance of Nurses for Healthy Environments. We are a group of nurses from all walks of the nursing profession who are committed to addressing climate change and other environmental health threats by educating, motivating, and supporting individual nurses and nursing organizations. You will also find a slide presentation with voice recording with more information about the Alliance of Nurses for Healthy Environments. We welcome you to join our Climate Change Committee, which has free monthly calls by which you can connect with other invested nurses from around the world. Time is right for nurses to step up. for our families and ourselves, and for the life as we know it for future generations. It is the future generations that are imploring us to do this. Colleague Bill McDonough encourages us to love all of the children of all of the species for all time. We have an opportunity and an obligation as nurses to begin to lean into the critical task at heart. I am confident that we can play an important role in shifting to a happier and healthier, more locally oriented future that protects all of our communities and is life-affirming for everyone.